Good morning. Thank you for everyone being here. Dr. Whalen was going to be here, but she's tied up chasing down some numbers and getting the logistics. Because like we said yesterday, this constantly changes. And from 1 second to the next it changes, from 1 hour to the next hour it changes, and by the time I'm done giving this press conference, it's going to change again. So I do want to thank Dr. Whalen and her staff down at DOH for everything that they're doing. I'm joined also here by Sheriff Apple and everything he's doing with his EOC and getting stuff out in the community, but I'll let him talk about that in a minute. But it's rapidly evolving, this situation. And we've said this before. First and foremost, you got to stay calm. This is the new norm. And if you follow what's been going down in Westchester County, it's hitting Orange County now. Now it's in Dutchess County. And it's slowly coming up here, and that's why I commend the governor what he's doing. He's basically trying to shelter in place without saying it, keep people off the streets, starting tonight. No non-essential employees are not to report to work. He's starting to slow it down because our hospitals will not be able to maintain a heavy level if it hits us quick. It's coming, people, hear me. Our numbers keep changing, they're going up, I'll get to that in a second, but testing is ramping down. Like I said yesterday, Albany Med, St. Peter's will test you only if they feel they should, and it's gonna be prioritized. It's gonna be a young person versus a senior. They're gonna make that triage decision at the hospital based on your signs and symptoms. So don't worry about it if you don't get tested. And we still, to the people, we get a ton of phone calls. People are looking for their test results. They're backed up. So it depends on where you went to get your lab work done, where it was sent. We had 2 people go together on a Tuesday night. Well, one person got it back, and we still don't have the other test result back. It's just the way it is. It depends where it got sent. So that's taking time. So be patient. And probably most of you who come back negative, and most people are, that's one thing we're not really highlighting. A lot of people are coming back negative. By the time you usually get the test back, you're almost out of quarantine anyway. But I said this yesterday, and I'm saying this again, it doesn't mean you're not going to get it. So please, follow the rules that we're putting out through DOH and what Governor Cuomo's been saying. But as this morning, from yesterday, we're up to 115 total numbers, 115 that's our new number for that have the COVID-19. And here's the one thing I want to point out: 318 people are under mandatory quarantine. That's down from yesterday. We're at 386 yesterday, so that number's come down from mandatory quarantine. And if you look at people that are under precautionary quarantine, we were at 571 yesterday. That number's up to 634. And the reason why I bring that up, it's going to continue to change because we're mapping and we're tracking and tracing where people been, who's been exposed. As that number goes up, more people are, but it's going to keep shifting and changing, especially after you get past the window where they can be out, even if they are found to be positive. So this has been evolving since March 2nd. Please pay attention. There's rules in the streets. Yesterday I was driving around. I drove by a park and I couldn't believe the amount of kids playing soccer yesterday. Most people are getting it. Kids, you're getting infected. Pay attention. Stop thinking that you're not going to be. And most importantly, stop thinking just because you're young, it's not going to affect you differently. It's proven now it's the exact opposite. Stay away from groups. If you go out, keep your 6 feet distance from everyone. Keep 6 feet. Remember, if you got a cough in your arm, and continue to wash your hands constantly. But one of the things I want to say, and I love about this county, is that people step up. And we had this company in Watervliet. M&A Bird is a company in Watervliet that makes girls' and children's and infants' bathing suits and swimwear. Well, the company knew that St. Peter's Hospital and Albany Med were running short on masks. So I know it's a hard picture, but we'll give it to you later. But they turned around and they started making masks for St. Peter's and Albany Med. I commend them. It's awesome what they're doing. This is what's great about Albany County. People step up to the plate and they're being creative to help the need of shortages that we're having, not just at the hospitals, but in different agencies. So thank you, Mary Bird and M&M Bird, for what you're doing to make a difference here in Albany County. Can't thank them enough. We're calling for more testing kits, and we have the shortage, and that's why they step back. So I'm agreeing with Governor Cuomo when we say to the federal government, get these testing kits to us. We've tested more than anyone else in this great country of ours, and that's why our case numbers are going up. But most importantly, it helps, and it's going to help going forward. So I'm begging the federal government, please step up to the plate, get these tests out, get them to New York, get them so we can continue to find out who has this. But most importantly, what you can do as residents, stay home. Stay home, don't go out if you don't have to, and stay away from public places. That's really gonna make a difference. And that's the only thing that's gonna make a difference, if you stay home and you abide by this. The governor's last executive order are requiring all, like I said, all non-essential businesses to close their offices and personal sites completely tonight by 8 o'clock. So please abide by that, 8 o'clock tonight. Before I turn it over to Sheriff Apple, I just want to say the mental health number's been a huge success. People have been calling. Listen, I don't care if you're just feeling a little anxiety. I don't care if you just want to reach out and talk to somebody, because it is a different world we're living in. Reach out to this number. Don't be ashamed. We're not tracking you. We're not taking your personal information. We're just someone there to talk to you and get you through this time of need, and that's what it's about. And I can't thank our mental health department enough. But the number, again, is area code 518-269-6634, 518-269-6634, and it's available 8 a.m. to 5 p.m., 7 days a week. I can't thank them. And please continue the e-cards with any well-wishings or drawings that you have for our nursing home. That puts a smile on our seniors in our nursing home. And most importantly, some people had some questions. You're going to see a different norm out there. You're starting to see the National Guard mobilize around the state of New York. You're going to see, you're seeing them now driving down the streets of Manhattan. You're going to see them around the community. And they're there to help set up field hospitals, get food out, do things. I applaud the men and women in the New York Army National Guard and the Air Guard that are here in New York State. And the governor's moving them strategically around the state to help out in the communities that are going to need it, to back up the law enforcement, to help out, do things when we're can't get out, that we can still get food and vital services to the people that need them. So I commend the governor on that. But Sheriff Apple.
First of all, thank you, Dan, for everything that you've done here in the county. I think these precautions that the county and the state have taken are definitely saving lives. People seem to be adhering to the guidelines. Our call volume is, in fact, as far as law enforcement goes, our call volume is a bit low. We did have a minor spike in domestics, which is going to probably continue to occur when everybody's confined to their house and everybody's getting a little antsy. EMS calls are on a rise. We still have deputies driving around in ambulances, just acting as an extra body, not so much for security, but to provide extra assistance. Supplies are scarce, and we're continuing to aggressively hunt down masks and other PPE for our law enforcement, EMS, corrections, even our dispatchers, and our firefighters. As I sit here today, we're out, fortunately, our first class of deputies just recently graduated, and all 13 of them are assigned to heat sealing small personal protective packs. We have N95 masks, goggles, gloves, and gowns. We're heat sealing them, and we want to try to distribute them to every single first responder in the county. I know it's an aggressive feat, but we've already knocked off about 450 of them, so we'll be distributing those throughout the day as we continue to make them. One thing I would like to point out, I think we're grossly misusing a lot of our personal protective equipment, folks, and I can't stress enough, we need this. The state has dedicated a large cash to the hospitals and skilled nursing facilities. After that, it goes to different medical facilities, and then, of course, our first responders. But I see a lot of people even driving around with masks on, taking them on and off, and I'm talking about the N95s that are very scarce at this point. please, if you don't need to use it, and I'm talking specifically to first responders as well, if you don't need to use it, if the person has a bad hip and shows no symptoms, that may not be a time to use it. So we're asking everybody to please be very diligent in how you utilize that. One other quick thing before I wrap up, gun sales in the county are skyrocketing. And I'm a Second Amendment person. I believe in the right to bear arms, but I just want everybody to do that safely, cautiously, responsibly. And so if you do have a weapon that you've recently purchased, please know how to use it. Please know how to store it. We don't want anybody getting hurt, and I certainly don't want anybody shooting at first responders as they come to a house to respond to a call. So please, I have no issue with anybody buying guns or using guns or carrying guns, but do it safely and responsibly. So that's pretty much wrapping it up for us. As far as our deputy who had tested positive, he gets out of quarantine, I believe, Tuesday. No other deputies showed any symptoms whatsoever, so some will get out Monday, some get out Tuesday, the rest Wednesday. We have 2 inmates in isolation, no other signs up there. We have 89 isolation cells ready to go, but so far we've been very diligent at controlling access and fever testing and everything else, every person that goes in our 911 and our correctional facility. So I want to give a big shout out to all the first responders out there, especially those in the sheriff's office. They've been going out and disinfecting police stations, ambulances, county office buildings, the DA's building, our buildings. Yesterday we disinfected a large portion of the correctional facility with equipment that we're renting and or purchasing. So they've been working hard. We're probably going to switch to 12-hour shifts this week, just in an attempt to keep people from burning out. So they're working hard, and we're out there for you. I want you to know that we're going to do everything in our power to stay healthy so we can respond to you. But we need you to continue to work with us and take every precaution possibly to keep this from spreading. So thank you.
Thank you, Sheriff Apple, as always, and to your men and women that do a great job, not just at this time of emergency, but year-round. One of the things I wanted to mention, there are 6 people currently in the hospital at all these cases. And, you know, if you really put it into the light of things, that puts the hospital rate at 5%, which remains low. And I believe the state's reporting between 14 to 24% on a statewide level, which is good. It means we're doing our job, and people here in New York are helping us do our job. And remember, to the people watching this or listening to this, this is a marathon. It's not a sprint. This is going to go on. This is going to be the new norm. So probably about June. Put it in your minds, June, July, before we get out of this. So there's more to come. I just want to remind you, stay calm, and if you do, reach out to that mental health number if you need it, and take a step back, take a deep breath, go for a walk. It's a little chilly today. It's supposed to warm up later on in the week, but get outside and get a little exercise, but maintain your 6 feet distance, and we're here if you need it.